Dementia is a broad word for a decline in mental ability, severe enough to interfere with daily life, affecting memory, thinking, behavior, and emotions. Not a specific disease, but caused by various conditions like Alzheimer's, vascular dementia, and Lewy bodies. It's a progressive condition, worsening over time, and while there's no cure, research indicates that a good diet and lifestyle may help reverse it. Treatments in general include managing symptoms, and support helps maintain quality of life as it impacts memory, language, problem-solving, and daily tasks. 5 key characteristics. It is not normal aging. It's more than expected age-related changes. It's a significant loss of cognitive function and memory. Symptoms include memory loss, confusion, difficulty with language, problem-solving, mood and behavior changes like anxiety or personality shifts. Symptoms worsen gradually, increasing the need for care, but the speed varies. Multiple causes. Over 100 conditions can cause dementia, with Alzheimer's being the most common, followed by vascular dementia and Lewy body dementia. Mixed dementia. Some people have more than one type, often Alzheimer's and vascular dementia. 3 impact stages on daily life. Early stage, mild memory issues, but still independent in most self-care. Middle stage, thinking becomes harder, needs prompts for daily tasks. Late stage, requires full-time help with basic activities like eating and bathing. Imagine your brain as your best friend for life. It is small, only about 2% of your body weight, but it uses about 20% of your blood, 20% of your energy, and produces about 20% of your body heat. It works hard all day and all night. So, what you eat, drink, and do every day really matters to how well your brain works, now and in the future. This video is about how food and simple daily habits can lower your risk of dementia and help your brain stay sharp, even as you get older. Dementia is a word for more than 100 brain diseases that slowly damage memory, thinking, and daily function. Alzheimer's disease is the most common type of dementia and makes up about 70% of cases. Changes in the brain that lead to dementia can start more than 30 years before any symptoms show. That sounds scary, but it also means there is a lot of time to do something about it. The speaker of the original video is a doctor who has worked with brain health for many years and who also cared for her father for over 10 years after he was diagnosed with Alzheimer's and vascular dementia. We saw his thinking and memory get worse, but we also saw that it is never too late to make a difference. At age 80, he started going to the gym, gained muscle, and his mental abilities improved. So age is not the main problem, but what we do every day. We explain that dementia is now the #1 cause of death in women in Australia, and the #2 cause of death in men, after heart disease. Many women worry more about breast cancer, but dementia is actually more likely to kill them. Research suggests that if we address 14 known risk factors, we could cut global dementia by about 40%. But those official lists barely talk about food. If we add strong diet changes, it might be possible to reduce dementia by up to 80%. Because only about 5% of cases are driven mainly by genes. That gives real hope. We shares 20 lifestyle risk factors that you can change, and we makes them all start with the letter S, so they are easier to remember. Some examples are sore gums, stiff blood vessels, sugar, starches, soft drinks, seed oils, spirits or alcohol, smoking, smog in air, sensory loss, sleep problems, snoring from sleep apnea, stress, sedentary life, low sunlight or low vitamin D, and social isolation. Loneliness, we says, can be as harmful as smoking about 15 cigarettes a day. That is a big hit to the brain and body. But the good news is, these are all things you can work on. One surprising brain risk is sore gums and poor mouth care. The bacteria that cause gum disease can travel from the mouth to the brain and damage areas involved in memory and learning, like the hippocampus. People who do not brush or floss well have a higher risk of cognitive decline and Alzheimer's. So taking care of your teeth is not just about a nice smile, but also about a sharper brain. We spend a lot of time on food, especially sugar and ultra-processed foods. We point out that around 80% of supermarket shelves are filled with processed packaged products. Research following about 10,000 adults for around 8 years found that people eating the most ultra-processed foods had about a 28% faster decline in overall thinking and about a 25% faster decline in executive function, which means planning and decision-making. Another piece of research shows that every 10% increase in ultra-processed food in the diet is linked to about a 15% increase in type 2 diabetes. But midlife type 2 diabetes can more than double the risk of dementia later, especially in women, with roughly a 2.3 times higher dementia risk in women and about 1.7 times higher in men. Sugar is one of the main villains. We explain that today, by the time a child is about 8 years old, they have often eaten more sugar than the average person ate in their entire lifetime about 100 years ago. People like to say, everything in moderation. But with sugar and refined carbs everywhere, we have lost what moderation really means. Sugar is not only the obvious sweets. It hides in breakfast cereals, sauces, salad dressings, bread, chips, pasta, rice, and many packaged foods. Your favorite tomato sauce can be mostly sugar, and starchy foods like chips and white bread quickly break down into glucose, another form of sugar. We explain sucrose or regular sugar as a simple mix of two sugars, fructose and glucose. The body handles them differently. Fructose at today's high levels can change genes in brain areas like the hippocampus and hypothalamus. It can damage the way brain cells talk to each other. In animal research, when rats get a lot of sugar in their drinking water, they get lost in mazes and behave as if they are drunk. Some damage is lessened when they also get omega-3 fats, like those in oily fish, but that is not a free pass to eat lots of sugar. Fructose also drains brain energy. It harms mitochondria, the tiny power stations inside cells that make energy. Most foods you eat help your body make more ATP, which is the cell's main energy fuel. But fructose is unusual because it can make ATP levels go down, while also raising uric acid in brain cells and adding to oxidative stress, insulin resistance, and leptin resistance. When you are resistant to leptin, the hormone that tells your brain you are full, you feel hungry all the time. People say they could never live on a low-sugar or low-carb diet because they think they will always feel hungry. But once they cut back sugar, especially fructose, their hunger often drops on its own. Glucose has its own issues. In many people with dementia or other brain diseases, brain scans show that some brain areas use about 20% less glucose than normal. That means those neurons are starving, even while the blood sugar may be normal or high. Eating more glucose-rich foods does not fix this if the brain cannot use glucose properly. High glucose intake over time can also lead to insulin resistance, type 2 diabetes, abdominal obesity, and heart disease, which all raise dementia risk. There is another twist. Extra glucose in the body can be converted into fructose, especially when combined with salt, dehydration, and alcohol. So that big salty, starchy meal with beer, chips, bread, and sugary sauce becomes a perfect storm for the brain. You get fructose from the sauce, glucose from the chips and bread, salt to push some glucose into fructose, and alcohol to drive that process even more. It may feel like comfort food, but it is bad news for brain cells. We know some people will say, but people in Asia have eaten rice for centuries and lived long, healthy lives. Her answer is practical. If you had a serious peanut allergy, you would not eat peanuts, no matter how healthy they might be for someone else. Some brains seem to have a kind of allergy to sugar and refined carbs. They just cannot handle it. So what works for your athletic neighbor might not work for you, especially if you already have memory problems or early dementia. We also talks about drinks. We says the worst way to take sugar is to drink it. Every soft drink, we says, is like a bullet to your brain. Research shows that if you changed nothing else in your life but added just one small can of soft drink a day, after a year, you could be around 6 to 7 kilograms heavier, and your risk of type 2 diabetes could go up by about 22%. Fruit juice is also a problem. Once you remove or crush the fiber from fruit, all that is left is sugar and water that hit your bloodstream fast. Even smoothies can do this when the fiber is heavily blended. Eating whole fruit is far better than drinking fruit juice. So what do we suggest instead? Her first simple rule is, get real about every meal. Eat real food that comes from the land, the sea, the sky, or a tree. Avoid food from packets and tins as much as you can. Real meat, fish, eggs, non-starchy vegetables, some whole fruits, and natural fats form the base. We often use as a low-carb or ketogenic-style diet for people with dementia. But we usually brings them into it slowly, not overnight, so it feels doable. A ketogenic diet means the body makes ketones in the liver from fat when there is very little sugar and very little insulin in the blood. These ketones can be a cleaner fuel for brain cells that struggle to use glucose. If you are going on ketogenic diet, monitor blood pressure and LDL cholesterol levels. If some brain regions have a 20% energy gap because they cannot use glucose well, ketones can help fill that gap. Ketogenic diets have been used to help treat epilepsy for more than 100 years. Research in people with Alzheimer's using a modified ketogenic diet for about 12 weeks has shown better daily function and better quality of life. We keep the advice simple for older people. Use the palm of your hand as a rough guide to your protein portion. Do not be afraid of natural fats. Small amount of the chicken skin does not matter much. But cut down the sugar and processed starches. We also strongly suggest time-restricted eating or some form of intermittent fasting, plus daily movement. Exercise is non-negotiable in her view. Both aerobic exercise like walking or cycling and strength training help the brain. Grip strength is linked with better memory and thinking performance. Exercise also raises BDNF, a brain chemical that supports the growth of new brain cells and new connections. Beyond food and exercise, we remind people not to ignore other S factors. That means stop smoking, limit alcohol to much less than the old guidelines, improve sleep, treat snoring and sleep apnea, get enough sunlight from vitamin D, manage stress, keep your mind active with new things, and protect your social life. We explain that smiling and giving real compliments are not just nice manners. They help build trust, lift mood, and strengthen relationships. Good relationships can cut dementia risk and make life with memory problems much easier to handle. The key message is, be hopeful. Dementia is not always fixed or cured, but many risks can be lowered. Food is powerful, and so are movement, sleep, and connection with other people. Small daily changes can help your brain at any age. You are not powerless. Next, we go to the article by Dr. Michael Greger, MD, FACLM. While we are in the middle of the video, click the like button and subscribe to my channel. It is a simple help to me, encouraged to make more videos. What is behind the dramatic increase in dementia in Japan over recent decades? As you can see at the start of my video, How to Prevent Alzheimer's with Diet, rates have climbed significantly. Is it due to rising obesity rates or increases in cholesterol, saturated fat, and iron from increases in animal products and meat supply for Japan? Overall in Japan, calories only went up about 10%, but animal fat and meat consumption rose 500%, which was about 10 times the rise in sugary junk. During this time span, rice consumption went down. Was white rice protective in some way, so the decrease in intake is to blame? Instead, the thinking is that they were eating something worse. It seems that the association between rice supply and AD, Alzheimer's disease, in Japan is more likely due to replacement of rice by animal products. It's like when fish consumption is found to be correlated with less disease. So you have to wonder if the decrease is actually because of something protective in fish, or instead, because fish just isn't as bad as other kinds of meat. If you look across multiple countries, you see a similar pattern. The most important dietary link to AD appears to be meat consumption, with eggs and high-fat dairy also contributing. There appears to be a really tight correlation between Alzheimer's and per capita meat supply. Studies within countries have uncovered similar findings, with Alzheimer's and cognitive decline associated with meaty, sweet, and fatty diets, whereas most plant foods are associated with risk reduction. This could be for a variety of reasons. Animal products tend to have more copper, mercury, lead, and cadmium, and no folate, and also contain saturated fat, cholesterol, and pro-inflammatory advanced glycation end products. In fact, there are many mechanisms linking meat in particular and diet in general to risk of Alzheimer's. So dietary modification may be our best bet for reducing risk of Alzheimer's. How do we know that it's cause and effect, though? What is the evidence that meat consumption is linked causally to Alzheimer's disease? There are a number of plausible mechanisms. The strength of association, consistency of findings across different types of studies, the fact that the dietary changes preceded the risk of dementia, and the dose response of more meat linked to more risk. We know that meat is a risk factor for other chronic diseases, but there have never been randomized controlled trials to put it to the test for brain dysfunction. When you read reviews of the damaging effects of a high-fat diet to the brain and cognition, a number of factors have been proposed to cause high-fat diet-induced damage to the brain, especially with aging, including oxidative stress, insulin resistance, inflammation, and changes to vascularization, BBB integrity, that is, the blood vessels, and the integrity of the blood-brain barrier. But these are based mostly on studies of rodents. Yes, based on MRI techniques, high-fat diets have been shown to cause energy dysfunction in the brains of rats. What about human brains? There are two sets of human cerebral arteries, the arteries deep inside the skull, on autopsy of non-demented elderly individuals compared to Alzheimer's patients. As you can see, the cerebral arteries of people with Alzheimer's are so clogged with atherosclerotic plaque packed with fat and cholesterol that they're nearly completely shut. With CT scans, you can follow the intracranial artery stenosis, that is, the clogging of the brain arteries, over time, and observe the progression from mild cognitive impairment to Alzheimer's disease. Those who had only low-grade stenosis were fairly stable over time in terms of their cognitive function and ability to dress themselves and execute other activities of daily living, whereas those with more arterial clogging started to slip over the years. In contrast, those who started out with the most brain atherosclerosis rapidly went downhill and were twice as likely to progress to full-blown Alzheimer's. Chronic consumption of Western-style diets enriched in SFA, saturated fat, and cholesterol compromise cerebrovascular integrity, the integrity of the blood vessels in our brain. So, of course, pharmacological modulation of diet-induced dysfunction is recommended, but rather than taking drugs, why not just try to eat more healthfully in the first place? Key takeaways. The dramatic increase in dementia in Japan over recent decades has been associated with an increase in animal products, including meat, and a decrease in rice consumption. Animal fat and meat consumption has gone up by 500% in Japan, while calories only increased by approximately 10%. Across countries, intake of meat, especially, as well as eggs and high-fat dairy, appears to be the most important dietary link to Alzheimer's disease. Alzheimer's and cognitive decline have been associated with diets heavy in meat, sweets, and fat, while most plant foods are associated with reduced risk. Many factors have been proposed as the cause of high-fat, diet-induced damage to the brain, particularly with aging, including inflammation and changes to blood vessels and the integrity of the blood-brain barrier. On autopsy, the cerebral arteries of Alzheimer's patients are so clogged with atherosclerotic plaque packed with cholesterol and fat that they are nearly closed. The standard American diet, rich in saturated fat, cholesterol, and animal products, has been shown to compromise the integrity of blood vessels in the brain.